The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. This is the week. It happens every year. Medicare enrollees have the option to evaluate their Medicare plans and do they want to change them. It happens October 15th through December 7th. And of course, we'll be talking about our SHIP people who are out throughout the state that can help you pick out the best plan for you. Plus, if you have any questions, they're the ones to ask. So stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. And I mentioned that we'll be talking about Medicare today, how important it is to evaluate your plans once a year. You only have that opportunity. So of course we have the state Medicare Health Director with us, Janet Stellman. Welcome to the show. Back to the show.
Thank you. Yes, I am the state Medicare SHIP Director, which stands for State Health Insurance Assistance Program.
That's right, yeah. And you have people throughout the state to help people with Medicare. But let's start with the basics right now. What is Medicare?
Right, and we do this every time, but it doesn't, people are out, there's always new people coming in, and it doesn't hurt to talk about it. So Medicare is a federal health insurance program that comes from the federal government. It was started back in 1965. So it covered, through the years, it's expanded, and it covers people that are 65 and older and people that with disabilities that have been determined disabled through Social Security. Mm-hmm. So it is, and up until 2003, there was no prescription coverage. So starting back in 2003, during the Bush administration, they through the Medicare Modernization Act, they created a drug program for seniors, or they passed that. So that started about 2006, and the first time in all those years that people on Medicare could have prescription drug coverage. So, so let's go over the basics. Medicare is, there's 2 ways to get your Medicare. So the first way is the original or traditional way, which is, do you have Medicare A? Medicare A pays your hospital coverage. Most of us have enough work quarters, 10 years or 40 work quarters, to get premium free, Part A. So if we didn't have Part A, it's like $500 a month. So that's for your hospital coverage. The second one is Medicare Part B, which is your doctors and your durable medical equipment, your outpatient stuff. And that has a premium of right around $175 a month. And that, again, that's for your doctor services. The new, with the addition with the through the Medicare Modernization Act, then you can pick up a prescription drug plan. And those are to help cover the drugs that you take. Also, with the traditional model, you can pick up what's called a Medicare supplement or a Medigap. So these are private insurance companies that help you pay your portion of Medicare. So traditional Medicare, original Medicare is an 80-20 split. Medicare pays 80%, the beneficiary pays 20% after all deductibles are met. So these supplements or Medigaps, they could be anywhere from $100 to a couple $100 a month, but they will help pay that 20%. So depending on which plan you get. The other way to get Medicare is through Medicare Advantage or Medicare health plans. And these came out about the same time as the prescription drug plans came out. And it is a different way to get your Medicare. So it's these private insurance companies that they go to Medicare and say, hey, we think we can do this cheaper than you. And so Medicare says, okay, we're going to give you a pot of money and you administer their Part A, Part B, and drug benefit. And so it has to cover everything that traditional Medicare covers. It just might cover it differently, and there might be some extra benefits. So with these plans, instead of paying 20% over here on traditional Medicare, you might pay $10 every time you go to the doctor, or this flat fee for every time you go to the emergency room, or this flat fee for MRIs and labs and stuff. So you kind of know what you're looking at. Medicare Advantage plans most of them require in-network or preferred providers. And one of the traditional Medicare does not cover vision, dental, or hearing, where Medicare Advantage plans, sometimes they offer that as an extra benefit. It might be just a cleaning or a, coverage for an extraction or, but it's a little bit of coverage there that's, probably isn't going to cost a lot or anything depending on what plan you're in. The other thing about it is it's a max amount of pocket. So a traditional Medicare, you're 80-20 all year long. Where with Medicare Advantage plans or health plans, there is a maximum amount of pocket, whether it's in-network or out-of-network. And so like one of them for this year was like $4,100 maximum amount of pocket for all in-network. And their out-of-network was like $5,500. So if it was in and out of network, if you spent $5,500, say you had a surgery and it was $20,000, you would be responsible for that $5,500, and then the rest of the year the plan's going to pay the rest of your medical expenses. So.
Well, now, Janet, you're pointing out that Parts A and B are static. There's no choices on those. But the Medicare Advantage and the Part D, there are variables there as to what kind of drugs you cover or what choice you have. We have SHIP people that can help you decide. They're statewide. Can you quickly tell us about the SHIP people? So
we have SHIP counselors across the state. There is one that covers every county in the state. So you can give them a call. The number's on the screen. They are there to help you through guide you through the maze of Medicare. It's one-on-one assistance. It's confidential. It's unbiased. We don't have anything to sell. We don't make a commission. We're just there to help you. So, and they are great. Our people are great, and they care, and they really want to help you out and help save you money and make sure that you're getting into the right choice.
And they're standing by. They're waiting for your call. We're drawing to a close quickly in our first segment here, but we're talking about Medicare. You have an A and a B, which are static. As to what they are, the Medicare Advantage and the drug plans, there are variables in there. And what we want to focus on here is we have SHIP people throughout the state that can help you evaluate and you decide what plan best meets your needs. They are very knowledgeable about these topics, and we'll talk more about them in the next segment, so stand by. We'll be right back. You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
A message from FireSafe Montana. Living in the wildland-urban interface means acting for your family's safety. Each year, thousands of people are ordered to evacuate. Do you have a plan? What are you evacuating through? Does yours look like this or like this? Mitigation of the fuel hazard on your primary travel route is vital to your safety. Contact your local mitigation program or fire authority for help. This message brought to you by FireSafe Montana and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and continuing our discussion about Medicare. You should have received this pamphlet in the mail. It explains what Medicare will be for 2025. It has everything you need to know that you can go through and you can read it. But if you have questions, we have SHIP people, State Health Insurance and Assistance people. This week, October 15th through December 7th, is an open enrollment period. You can evaluate your Medicare plan and see how it best meets your needs. And we advise you to do it early because, you know, we only have so many people working for us, and when December 7th comes along, they want to enjoy Christmas too. Of course, we have a wonderful guest. Joey joining us is Janet Stellman, and we'd like to talk about open enrollment. Right. What is that, and why is it important?
So it's our busiest time of the year. So October 15th through December 7th is a time for you to evaluate what Medicare you're on. If you're on traditional Medicare and your prescription drug plan, or if you're in a Medicare Advantage plan with drug coverage, you know, are those plans going to work for you? Because what worked for you this year may not work for you next year. So here in about probably last month at the end of September, you should have received an annual notice of change or evidence of coverage from your company. And what that does is it tells you what the changes are going to be for 2025 if you stayed in that plan. So it's going to talk about the costs and the deductibles, the network, if it's changed, if your doctors are still in network, if their formulary on their drug plan has changed. So that document is really important to read, just to see what's going on. Also, you may get a plan non-renewal notice saying, hey, this plan might be ending, and so you really need to either look at Medicare.gov at the plan finder to find another plan, or call a SHIP counselor to help you go through that. It's really important, since we're right here on October 15th, to be calling those SHIP counselors and getting on their books, because they fill up, and at some point, usually towards the end of November, we're telling Medicare we don't have any more appointments left, and so everybody will have to call 1-800-MEDICARE to get it done over the phone. So call early if you want to get in with a SHIP counselor. So, and the number's on the screen. Also, you might know, this happens, you might get a notice that your plan is a consistent poor performer. And it may be, if they've been a poor performer, meaning their customer service hasn't been good for the past 3 years, you might get a notice saying, hey, this plan has had poor customer service and you may want to look for another plan.
Oh, okay.
So whether they get sanctioned or whatever, it's because their customer service hasn't been up to par. Also in September, you should have received your Medicare New 2025 booklet. Those come out every year at the end of September or early October. If you didn't get one, you can call your local SHIP counselor and we can mail you one because we do order some for our offices. So here's some more stuff about, let's say that you don't have, maybe you have A and B, but you don't have prescription coverage because maybe you're working or your spouse is working, and you don't need to pick up a Part D plan because your insurance is considered creditable. That means it's as good as or better than Medicare. So you don't need to get into a Medicare Part D plan because your insurance currently works well. Every year about this time, your insurance should send you a notice that says, hey, your insurance is your prescription drug coverage is creditable, or it's not credible, whatever. So if it's credible, good. Hang on to that notice, because when you stop working or your spouse stops working, in order to not get a late enrollment penalty, you'll show them that notice and say, hey, I had credible coverage, so don't ding me. Don't ding me. So that's really important. Also, if we have people that are getting extra help, that some of the Medicare helping programs, especially with their prescription drugs, those notices are coming out too. So if you got a gray notice in September, it means that you're no longer eligible for Medicare or for the low income subsidy. So you're going to lose that. You might want to look at a different plan that's going to work for you, or reapply or ask for reconsideration. If you get an orange notice, it's going to tell you that you're on extra help and your co-payments are going to change. Also, if you get a blue notice, it's called a reassignment notice. So on extra help, there's zero premium plans. As long as you're in a zero premium plan, you don't have a premium. But every year that changes, so that plan may no longer be a zero premium plan, and so they're going to send you a letter and let you know that plan is no longer considered the best plan for somebody on low income subsidy, because it might be more expensive. And there may be some other notices that coming out too, that maybe if you're those people that are getting reassigned, if they've ever chosen a plan, they'll get a notice that says, hey, your plan's premium has gone above the benchmark. Since you've chosen your plans in the past, you probably need to look at it and get into another plan if that's still the concern, that you're having a zero premium. The other thing I want to talk about real quick is marketing. So the plans and all the companies, they cannot use language to suggest their plan is preferred by Medicare. They can't call or email you unless you've asked them to. And they can't leave info on your car or at your home if they are from a company that you don't already have an appointment with. So
interesting. That's really interesting. Well, we're drawing a quick close on this segment of the show. In our next segment, we'll talk about the SHIP people. If you're going to call them, what kind of information should you have in advance so they can help you better? And we'll also be talking about the special help programs that are available through the state of Montana and the feds, which can help you with your Medicare premiums and costs. It's a lot of great information. Stay tuned. We'll be right back.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
This October, author, scientist, and autism advocate Temple Grandin and Grammy Award-winning musician and anti-bullying activist Daryl J. Williams are coming to Butte for the Putting It All Together conference. 3 days of up-to-the-minute information for individuals with developmental disabilities and their families, plus an inspiring evening talk by Temple Grandin. Registration for the conference and admission to Temple Grandin's talk is free, but register early to ensure accommodations. Go to puttingitalltogetherconference.org for more information.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Hi folks, welcome back to Aging Horizons. I'm your host Brian Lamore, and continuing our discussion about Medicare. We're in the open enrollment period, which is October 15th through December 7th, and we have people that are SHIP, State Health Insurance and Assistance Program people, here to help you, and we want to talk more about that with Janet Stellman, who is the head of the SHIP program for the state. Now, when we left our last segment of the interview, we were talking about what kind of information maybe that, you're going to call up a SHIP person. What kind of information would you like prepared already so that, or what are some of the first questions a SHIP person might ask you in order to help you, and how can you get that information for them?
Right. So one of the things they're going to ask you to bring is probably your Medicare card. That has your number on it, and also a list of your drugs. What drugs you take. We need to know exactly what you take, what the dosage is, and how often you pick it up from the pharmacy. Because we're going to plug it into what's called the Medicare Plan Finder, and it's going to, based on the drugs you take, it's going to determine what will be the lowest price plan for you for the rest of the year. So one of the first things they're going to do is, if you already have a Medicare.gov account, they will ask you for your password or your username and password. We might already have it if you've given us approval to keep that in our database, but otherwise we'll need you to bring that with you. If you forgot it, there's ways we can possibly get it back. If you don't have a Medicare.gov account, it's really important to make sure that you have your Medicare card with you and your list of drugs. So we can either create an account or do a general account. It really helps to have a Medicare.gov account because it tells us and you what your current situation is, what plan you're on, if you're getting extra help, and it also pulls over all the drugs you've gotten in the last year for us to go through with you, so you don't have to bring us a printout. However, if you're new, you do, if you don't have an account like that. And so every year we go into that and we're like, okay. And then it takes us right to the Plan Finder, and we can go through, and it tells us, based on the drugs you take, what is the cheapest annual cost per year, which plan has the cheapest annual cost. So, and then we can compare plans, like here's maybe the cheapest, and then the next cheapest, and then the next cheapest. So we could compare those three side by side and say, here's what's going on with these. We can also do that with Medicare Advantage plans or Medicare Health plans, and go through and see what the top three are, and what works best for you. So it takes about an hour to do. If you feel like you are, if you're good with the internet, or your family member is, they can help you too.
Yeah, it's important that family members can help you out.
Right.
But you have to give them permission, and they know computers maybe better than the seniors do, so trust them.
Yeah, so they can help you that way. So it takes about an hour. We can do it over the phone. We can, they do offer in in-person appointments. So
yeah, that's great. Well, now let's change the subject a little bit. You know, there's some expense to a Medicare plan, and fortunately we have some helping plans that are available, but you have to be eligible, and each plan has different eligibilities. That's really when the SHIP person comes in. Please tell us about the plans and some generalities.
Right, and if you've heard me talk before, you know this is my favorite thing to talk about because it helps so many people. It's made a difference in so many people's lives. So, because we know that prescription drug coverage is expensive, we know Medicare costs are expensive. So, the low-income subsidy or extra help program, you apply for it through Social Security Administration, or a SHIP counselor can help you apply. It is a program that helps you pay for your prescription drugs if you meet the income and resource guidelines. They say the average savings is $5,000 per year, but as SHIP counselors, we know that's a lot more, because what happens is instead of you paying 25% of your drug cost, you're going to be paying co-payments anywhere from $1 to $13 or something per prescription, as long as it's in the formulary. So that's a big help, big help, because we know some of those drugs are so expensive.
Oh, yeah.
The second plan helping program that we talk about is the Medicare Savings Program. That is administered through the Medicaid office, but we can help you, SHIP counselors can help you apply for that. It is a program that they say it's an average savings of $2,000 a year, but again, we see that it can be much higher. So it really pays your Part B premium, so that $175 a month. So that puts it back in your pocket, $175 a month. So if you only get $1,200 a month and you get that $175 back, that's awesome. So. And the other thing is there's 3 levels of it. So the people with the lowest income and resources, the Cadillac model is called QIMBY or QMB. And not only does it pay your Part B premium, but it also pays that 20% that Medicare doesn't pay. Because I said Medicare is an 80-20 split. It acts like a supplement to Medicare and pays that 20%. So we know that adds up to more than $2,000 a year. So that's great. The other 2 programs just cover that premium, that Part B premium. Also with QIMBY, the Cadillac model, if you're one of those people that don't have enough work quarters or years in and you have a premium for Part A, it'll also pay that Part A premium. So that's $500 a month. So, wow. The other program we like to talk about is Big Sky RX. It is our state pharmaceutical assistance program. It is administered by Senior and Long-Term Care. And what it is, it passed during the Schweitzer administration, and along with the Medicare Modernization Act, that we had to provide some kind of pharmaceutical assistance program. So Montana developed Big Sky RX. Big Sky RX is funded by tobacco tax. It's for those people that have a little bit higher income or things they own, resources. So it doesn't look at resources. It just looks at your income, and you get a little bit higher income. It pays up to, I think next year it's going to be like $50 of your Part D premium. So that's a big help too, and it's for people that don't usually qualify for things. And it's it's a way for Montana to give back, and it's funded by tobacco tax. So thank the smokers on that.
Janet, thank you so much for being on today and explaining this to us. And if you're needing more information, maybe for a loved one or yourself, contact a SHIP person. There's so much information out there that it might be a little bit confusing, but it isn't confusing to us. We have people to help you. Give them a call. There's nothing to lose. They'll help you out. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.